Welcome to Moments with Marianne. This is your host, Marianne Pastana, and we're here today with special guest, Jessica Altman, who's here to share with us Covered California's first open enrollment deadline. The first open enrollment deadline for Californians who want health coverage starting January 1st is quickly approaching, but people in our own community have questions about their health insurance options and how federal decisions may shape the cost in the new year. To help consumers understand that there are options available to meet their healthcare needs and their budgets, in some cases with financial assistance, Jessica Altman, Executive Director of Covered California, joins us now. So welcome to the show, Jessica.
Thank you for having me.
Well, what an honor it is to have you here and to talk about this very important topic. I'm sure many Californians have questioned about the affordability of health insurance, especially following recent federal decisions that may shape costs in the new year. So what should they know?
So first of all, we're talking about Covered California here and the costs on Covered California. Covered California is the health insurance marketplace for the state of California, and we were created by the Affordable Care Act really to provide health insurance to people who don't have another reliable source of coverage, people who are working but who don't have the privilege of working in a way that an employer is offering them health insurance and paying for a large portion of that health insurance that generally happens in the workplace. So instead, the federal government has funded tax credits that are provided only through Covered California here in the state, lower the cost of coverage, and bring it within reach for people depending on their income. Now, a few years ago, they made those tax credits more generous, both giving more to people already receiving them and then also making them available to middle income consumers for the first time. This is why we call the policy in question these enhanced tax credits, because they built upon tax credits that we already had. Now it's those enhancements, the greater generosity of the tax credits, that is expiring at the end of the year, and Congress has needed to, but has not yet acted to extend them. And so with these enhancements potentially going away, people are looking at higher costs through Covered California for the nearly 2 million Californians that rely on us for coverage, for the around 190,000 in San Bernardino and Riverside who rely on us for coverage. Now, most people will still be eligible for tax credits as we head into the new year, but again, how generous they are can have a pretty big impact on what you're actually paying each month for coverage.
So can you share with us about open enrollment trends and the data for our area?
Absolutely. So open enrollment, we are in it. Open enrollment is this window where anyone who needs health insurance or is enrolled in Covered California can shop, renew their plan, or hopefully enroll. And so we're closely watching the data. It is really early. We haven't gotten to some of our key deadlines where we tend to see the data move, and we don't necessarily expect this year to look like other years. But a few things that we are seeing that are happening statewide, including here, is new enrollment. So people who need to come and shop on Cover California but aren't already enrolled in 2025, that number is down by about 30% when you compare exactly the same point in time this year to last year. So that tells us consumers either are seeing headlines and saying, I'm not going to come check, or they are logging into Cover California. Maybe they know that this is uncertain and they're waiting, or they're seeing prices that are not within their budget or what they were hoping to pay and not enrolling. So that's one we're watching. It's one that could increase at the deadline. We hope it does. But again, that trend is looking like people aren't coming in at the same pace. Then we are also seeing people choosing to shop and finding plans which are available to most of our enrollees that come at a lower monthly cost than the plan they're enrolled in today. The most common version of that is moving from one plan that has a higher monthly cost and a lower deductible and other out-of-pocket costs to one that costs less per month but has those trade-offs down the line if you seek care. Now, those people are saying, I intend to stay covered, but I need to make a change to fit my budget. There are trade-offs there, but it does show people are paying attention and that they are coming in and doing exactly what they should do, which is shop, see what's available, and find a plan in budget.
So, for those people who may be uninsured or unsure if they qualify, what's the biggest misconception you've encountered?
Yeah, I share a lot of averages, and rightly so. It's the easiest way to capture this impact. But the actual cost and the actual impact really varies depending on your circumstance. In particular, where you fall in the very broad spectrum of incomes that we cover on Cover California, from just above eligibility for Medi-Cal, also called Medicaid nationally. That's someone making about $25,000, $30,000, and we don't have an income cap. And all of our financial support, with or without the enhancements, is on a sliding scale. And so the experience of someone at that lower income and then someone who could potentially lose their tax credit altogether at a more middle income level is quite different. So the number one piece of advice I have is not to make assumptions, especially at a time when there are a lot of headlines out there with a lot of scary numbers. Come to Covered California, be empowered by being informed with direct information about you, your family, your household, and what costs could look like. California is also doing what we can to help. We do have some funding from the state budget to mitigate some of this. And again, that is not enough money to help everybody who could lose some of this federal funding, but it is enough to be meaningful for some. And that will also matter as you look at your projected costs for 2026.
There's just a lot of discussion in Washington about steps Congress should take that affect premiums. So, what actions could help keep costs manageable? And what is California doing to protect affordability for consumers?
The clearest thing that Congress should do, the only thing that would ensure no one sees these large price increases from what they're paying last year, and the way to do it that we can implement this very quickly and deliver changes to people in real time, is to extend the enhanced premium tax credits as we've had them since 2021 through Covered California and other marketplaces around the country. Now, there are other policies sort of tweaking that tax credit structure, bringing other things, and we'll have to see how that conversation goes. But the clearest, most obvious way to protect consumers in this moment is just to extend these enhanced premium tax credits.
So, what essential health benefits are included with every covered California plan?
It's a wonderful question. Every single health plan on Cover California actually covers the same set of benefits. So this is one thing that sort of takes out the noise, that you don't have to worry that one plan will cover something you need and another won't. So these are all of these categories, from an emergency at the hospital to specialty care, primary care, but also prescription drugs, behavioral health services. And also every plan covers preventive healthcare services, cancer screenings, vaccines, primary care visits at no cost to the patient, no deductible applied to those services. And so it really is financial protection in the case of something unexpected or for someone with a very significant healthcare need. But it is also a way to be able to invest in yourself and your healthcare and your family's healthcare in the future by getting the checkups that will help you stay healthy now, but also into the future.
So, what tools are available to help residents choose the coverage that best meets their needs?
Our job at Cover California really is to help Californians on their journey to health insurance and hopefully support as many Californians in getting health insurance as possible. So we really do try in a system that I know can be quite complicated and daunting to make it as easy as possible. One of the ways we do that is by letting you enroll really however is best for you. You can always start on coveredca.com. That's our website. You can do the entire application process there. You can take truly less than 2 minutes, enter a few quick details, and get a quick quote on how much tax credit you're eligible for and what plans are available. You can also call us. And then we also have over 14,000 enrollment partners, Californians who are helping other Californians access health insurance across the state. These are community organizations, they're clinics, they're insurance agents. They speak well over 40 languages, and they stand at the ready to walk you through every step of this process in whatever language that you prefer. You can find them on our website, or we will actually find one for you through our help on demand capability. So really, how can we help? We're here to do it. We have all these resources waiting for you to call.
Well, it seems that Covered California has really thought this out and is very well prepared to assist people with their healthcare coverage as we go into 2026.
That's certainly our goal. Again, people cover California, we're pretty new on the health insurance scene, about just over 10 years, and people don't always know what we are, right? We're not a health insurance company. We're a marketplace that works, haggles with and negotiates with health insurance companies on your behalf. We're not an insurance agent. We don't gain a commission. We're a free service offered by the state, and our mission is to help you.
Well, Jessica, thank you so much for taking the time to be on the show with us here today.
Thank you again, Marianne, for having me. It's been fantastic.
Well, thank you, Jessica. It's been such an honor to spend this time with you and to talk about the open enrollment deadline for Covered California. To learn more about healthcare options for you, visit coveredca.com. Well, we're at the end of our time today. I'd like to thank everyone for tuning in. You've been listening to Moments with Marianne, where we make every moment count.
In a single moment, your life can change. Moments with Marianne is a transformative hour that covers an endless array of topics with the best of the best. Her guests are leaders in their fields, ranging from inspirational authors, top industry leaders, and business and spiritual entrepreneurs. Each guest is gifted and a true visionary, a recognized leader in her own work, and while teaching others to develop, refocus, and grow, Marianne will bring the best guest and sometimes a special surprise. Don't miss this. You never know just which moment will change your life forever. Make sure to tune in and visit momentswithmarianne.com for more information.